The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to our webinar this morning. In our broadcast, we've got a lot of valuable information to share with you over the next 45 minutes. And don't worry about taking any feverish notes. All the content today is going to be emailed to you after this presentation. I'm Pat Hennessy, Beere&Purves territorial sales rep here, and looking forward to share with you quite a bit of things today that I think you'll find extremely valuable as you're preparing for not only the second, the third, but also the fourth quarter. So as we talk about our agenda today, we're going to talk about a couple things. Number one are what's going on for the 7-1 carrier updates. Number two, Anthem is back. Anthem has been out as far as non-competitive for a while now, and now Anthem Blue Cross medical and dental rates have become very competitive, and we really want to make sure that you are using Anthem and quoting Anthem going forward, specifically in certain counties, and we'll talk about that in just a moment. We're going to talk about the competitive plans and rates. We have 19 rating regions here in California. We're going to focus on the ones here in the Bay Area. Also, we're going to talk about the pharmacy and provider search tools. What we're finding now is just because you're moving a group because of price, if the owner of the company and their family are going to experience a hardship because the provider is not in the network of the carrier you're moving them to, or their medications are going to cost them significantly more or not covered at all, these are things you need to find out in advance prior to moving the group. We've had a couple of groups blow up because the broker did not go ahead and do the provider and pharmacy searches, and now we've got a tool to help you with that. And finally, we're going to talk about how to fill a pipeline with cold call prospecting. This is something that has been very challenging for all of us, myself included, and how do you go about doing that in a very efficient way? So we're going to touch on that as well. So let's talk about the medical updates. We're going to start with Aetna. And again, Aetna is very competitive in the bronze PPO. They've got, that's really where their niche is. But one of the things I want to really point out today is that any new business sold with Aetna must be submitted by the 20th of the month prior to the requested effective date. If it is not submitted by the 20th of the month prior, then it will roll to the following month. So for those of you that have 6-1 groups, if they're not in by the 20th of the month, they're going to go to 7-1. That means that the rates will change and possibly the plans will change. So please be mindful of that. They're the only carrier that have that requirement. Now let's move on to Anthem Blue Cross. Anthem has been very competitive in 9 rating regions. The other thing we want to share with you is that if you have an employer that is taking medications or a number of meds, they are the most friendly when it comes to pharmacy and formulary. We get 85% of our special exceptions done through Anthem Blue Cross. We get none of them through United Healthcare. So those are things you want to keep in mind. If you have a situation where there's a lot of medications, you may want to look at going to Anthem because you're going to have a lot greater chances of success. The next one is promotions through 915. Now, we all know that you cannot have a narrow network and a full network PPO with Anthem, but you can have a full and a narrow HMO network. The reason brokers are doing this is they're trying to find a lower price point. So they'll benchmark off the employer contribution off of the narrow network and give the employees the opportunity to buy up to a full. You can do that with all the other carriers except for Anthem when it comes to PPO. 6 or more enrolled, the prior carrier bill is all you need in lieu of a DE9C. We had a situation where we had a restaurant, there was 30 lives, and we only had 7 enrolled. The group got recertified and we could not move them forward. They were stuck. The broker was able to use this situation where they used the prior carrier bill in lieu of the DE9C, and they were able to get the group approved with Anthem Blue Cross. The next one is really interesting because 5 or more enrolled, all you need is 30% participation. The example I use is the one that we had here where we had a group of 15. We had 10 in California, we had 5 in Nevada. The 10 in California went on to Kaiser, the 5 in Nevada went on to Anthem Blue Cross. And so the reason we were able to do that is that we had 51% participation in California. 51% of the eligibles lived in California. And then we had at least 30% that were in Nevada, and we did not need to have anybody enroll in California. And that's something I want to make sure everybody's aware of. They're very flexible when it comes to that. And then 4 or less, you need 65%. Individual coverage is a valid waiver. So the only time you're going to have a scenario where you do not have a group that has a valid waiver is if they don't have coverage at all. So that's important to know. Very friendly when it comes to underwriting at Anthem. The next one is startup friendly groups. Right now, the unemployment rate in California and across the country is 4% or less. That means that everybody that wants a job has a job. So therefore, as an employer, I really need to make sure that I am able to attract and retain my employees. And what I'm doing is, with a lot of these startup groups that are coming up, we want to make sure that they were able to go ahead and get started immediately. So for example, if we had a startup group, we could have a group start with Anthem Blue Cross on 6/1. The payroll starts 6/1, the coverage starts 6/1. As long as we have the group on the California Business Portal prior to 6/1, that group is off and running. They're the only ones that allow a group to have payroll and coverage start on the actual effective date. Then all we need to do is to give the carrier, in this case Anthem, 30 days of payroll, 45 days after the effective date, and we're all set. New group members submitted in real time. So now we get a group submitted to us with Anthem at 9 a.m. in the morning. By 5 the same day, we're going to have your individual ID numbers, and we're also going to have the group number. So that is something that's unique to Anthem, and amazing how the turnaround times have become significantly faster. The enhanced employer access. So what some brokers are doing is they'll use us for eCentral. We'll go ahead and get the group enrolled, open it up on Friday, open it up on Monday, shut it down on Friday. And then 30 days after the group is up and running, we have a conference call and we show them how to use the employer access tools, the electronic tools, directly to the carrier. So all the ads, deletes are all done, and gives the employer much greater access, and these changes are submitted right away. So that's something to consider going forward. And the eCentral connectivity goes right into Anthem, which is very helpful as well. One of the things I mentioned earlier today was that Anthem has been extremely competitive. I want you to take a good look at this graph, because what this shows, effective 7/1, this is comparing Anthem rates versus Blue Shield rates. You'll notice that Area 2, the legend is down there in the bottom to your left. You have Marin, Napa, Sonoma. You'll see that where you see 2%, that means that the Anthem rates are 2% higher. But let's look at Area 4, which is San Francisco, Area 5, which is Contra Costa. The same plan design within Anthem versus Shield, the Anthem rates are 10% lower in San Francisco and 11% lower in Contra Costa. You'll also notice in Area 7, Santa Clara, they are double digits below Blue Shield. So here's what brokers are doing starting for 7/1. They're going to the Contra Costa groups. A lot of the brokers who have existing Blue Shield business will basically say the renewal is 5% with Blue Shield, so we're not going to necessarily market it because it's under 10% increase, and we're just going to roll forward. The challenging broker will come in and show them Anthem Blue Cross. When they realize that the Anthem Blue Cross in Contra Costa County is 11% lower than what they are getting for Blue Shield, we had a broker and the group asked, why didn't you show me Anthem if it was going to save me 11%, even though I only had a 5% increase? This is really important. You want to make sure that even though you're getting a single-digit rate increase with Shield, which is where a lot of the business is, in these areas, Anthem has come in extremely competitive. And this is something you can use if you're prospecting groups and they say they're on Shield, and if they're in San Francisco, Contra Costa, if they're in Area 7, which is Santa Clara, Area 8, San Mateo, and even in Area 9, Monterey or Santa Cruz, Anthem is going to win. And we want to make sure that you're in a position to offer that, to retain the group that you have, or to go ahead and win a new group, when a lot of the incumbent brokers are simply giving the 5% rate increase and moving on. So this is going to be extremely valuable for a lot of those that are looking for business here starting 7/1. Please take advantage of this going forward. CalChoice is number one of our top carriers going into 2018. The primary reason is that the Kaiser rates are the same. So we do anticipate a lot of movement from Kaiser Direct to CalChoice in 2018. The reason, as I mentioned before, with the unemployment rate so low, I as an employer have to offer as many options as possible to appeal to as many of my employees and attract as many employees as I possibly can. By having Kaiser through CalChoice, my Kaiser rates are the same, so the Kaiser folks are happy. I'm also going to be introducing Western Health Advantage through Canopy, which we'll talk about in just a minute. That allows my employees to have access to UCSF at a discounted rate. And those that are out of state, because a lot of employees are moving out of state, they're going to go on to the Anthem Advantage or Select plans. So now with one carrier, CalChoice, I have solved all of my issues, don't have participation problems, and are not paying an additional load for Kaiser like I've done in the past. So we are starting to see a lot of groups move from Kaiser Direct over to CalChoice Kaiser. So please let us know if you need those quotes. We can turn those around very quickly for you. The Canopy is available, and we're going to talk about that in just a moment. The next one we want to talk about is HealthNet. Now, as we all know, HealthNet has kind of been off the radar screen for a long time now. They're actually going to be re-entering the market in Q4 2018. They understand that they have been, from a pricing standpoint, uncompetitive. They had lost, unfortunately, about 40% of their business and are now in a position where they've made changes and are re-entering the market just in time for the fourth quarter. So please give them a chance when you start spreading your groups for the fourth quarter. By the way, the 7-1 rates, the 12-1 rates are looking, we're looking to be released mid-July. The next one is United Healthcare. United Healthcare has been very competitive in the platinum and silver areas in 10 of the rating regions. The one thing I wanted to share with you, which is very helpful, if you have 10 or more eligible, all you need is that participation certification form in lieu of the DE9C, which comes in very handy in certain situations. They're very lenient alongside of Kaiser. So we had a group, 90 employees. The 5 managers wanted to go to a platinum plan. The rest of the employees were on a bronze Kaiser. So what we ended up doing was putting the 5 employees that were on the management team, they went on to Platinum United Healthcare plan. The other 85 went on to a Kaiser Direct plan, and that's how the group was written. Very lenient alongside of Kaiser. If you have groups that are outside of the state of California, we can help you by quoting all the states except for Nevada and Colorado. Those are the only states that we are not able to provide you with an out-of-state quote, United quote for. Nevada, you have to be a resident, you have to be a broker in Nevada in order to write the business there. Individual waivers are valid just like they are with Anthem, and 1 to 2 life groups, you have to use an ACH form, they won't take a check, so that's important to know as well. Let's talk about ancillary for a moment. What's happening now is the loss ratio mandate does not apply to ancillary. So a lot of the medical carriers are really trying desperately to increase their volume of business through ancillary lines. And so Anthem, for example, they decreased their rates when you look at 26 plus employees. And a lot of brokers never look to the medical carriers for the ancillary lines of coverage. We are starting to see a trend now where if the group is under 10 lives, it makes sense rather than writing the medical with Anthem and then the dental maybe with a separate, let's say Delta Dental, and then the vision with VSP. So now the employees have to fill out 3 separate contracts in order to have that line of coverage. A lot of brokers are now trying to just write them all together. Bundling together, getting a discount, as you see on the second bullet, 5% ancillary discount when dental is bundled with life and vision and or life. They have rate guarantee, and actually these plans are very good. So you want to give them a chance, and it's going to make your life easier and your group's life easier as well. And they don't require any DE9C. Implants are one of the common things that are being asked for now. Implants are covered under the Platinum and Gold plans with Anthem Blue Cross. And if you need the endo perio, there's no waiting periods, which is helpful as well for the non-voluntary. And ortho, this is interesting. Ortho, if you have 5 eligibles and 5 enrolled, orthodontia is available. Most of the other carriers, orthodontia is only available if you have the participation at a higher level. Choice Builders are number 2 carrier. Choice Builder, the nice thing about them, As I mentioned, having all under one roof. If somebody wants Anthem and Delta and VSP, you can write them all with Choice Builder. That's the other thing that's very popular now. And we don't need a DE9C or payroll for Choice Builder. Delta Dental, they had a rate pass, so they have not had a rate increase since 2014, which is amazing. So that's something to keep in mind. And they're our #1 dental carrier. There's a new P3 product I'm going to discuss in just a moment. Guardian, there's no waiting period, again, for 5 or more. The implants for 2+, which is amazing, which is very competitive. Most people, when they see implants, they want to have a threshold higher. Mets has decreased their rates for the 3rd quarter. Principal also is becoming extremely competitive. So we do have a nice variety of dental plans. And again, when we talk about bundling with dental, vision, life, AD&D, LTD, STD, those are things that a lot of our carriers can do, specifically Principal, which we've done quite a few here recently. And again, there's no DE9C required, which is very helpful. United Healthcare is the other carrier we want you to keep in mind as you're putting together your packaging, because they're the only ones, when you do a package savings, they discount with the medical. So if you're trying to come up with a creative way to bring down the medical costs, all the rates are filed with the state of California and they're all the same. But if you bundle, you're able to bring the medical rate down with United Healthcare. So we want to make sure that you're aware of that. Also, when we look at the vision, Costco's in network there, which is very helpful. A lot of people love going to Costco. So that's in network for vision with United Healthcare. LTD down to 2 enrolled, and then 10+, all you need is that participation certification form, as we talked about. VSP, the rates are the same going direct or through us. There's no load associated with them. And so VSP is very popular, and we have that available for you should you need it. One of the things I mentioned is that Delta Dental has come up with this new P3 plan. It's called your Personal Protection Plan. What it does, it includes 4 lines of coverage. One is teledoc, one is emergency assistance, one is legal assistance, and one is ID theft resolution. Now, there's no co-pays to use any of these, and one of the things I want to share with you is that $6 per employee per month. We've done a couple of these right now. They are very popular. It is a very inexpensive benefit when employees are trying to stretch their dollar for benefits. This is a nice benefit to have. Now, you cannot buy it on a standalone basis. It has to be bundled with Delta Dental as a rider. And the commissions, as you see, are 10%. So let's say we had a group, we had 20 people enrolling, or 20 people eligible with the Delta Dental, 15 enrolled on the dental plan. With this, all 20 would be eligible and must enroll onto the personal protection plan. So whenever you see P3, that means the P3 stands for personal protection plan and includes the 4 services that you see right there. 10% commission is also included, so it's also a great way to increase your revenue, and it's something new to talk about because this comes in very handy and is very competitively priced. Now let's talk about Canopy. This is one of the things I want you all to become experts at Canopy, because this is a great way, as our theme today is how to generate new business and keep what you have. So if you want to do both of those things, you want to be looking at Canopy. The reason being is Canopy has networks that are UCSF, at John Muir in the Bay Area. They also have Hills. In Marin, they've got Marin General, and they have the Alameda area as well. So what happens is, this is a physician association, an independent medical association. It is not an insurance company. So when you're explaining this, we have Sutter, which is a doctor association / insurance company. We have the Western Health Advantage, which is a doctor association / insurance company. And then we have Canopy. Canopy is a doctor association. It does not have an insurance company. So therefore, it has to connect to an insurance company, and the way it's doing that is through United Healthcare and through Western Health Advantage, which is through CalChoice. So what's interesting, we are starting to see a lot more activity with Canopy, and here's exactly what brokers are doing. So they're basically have a group that's on Blue Shield. First of all, they'll quote the if they're in the areas where Anthem is competitive, they'll go ahead and do that. The other thing they're going to be offering is Canopy through Western Health Advantage. What they're doing is they're getting the doctors and the hospitals for the employers, the owner's family, and their key employees. Once we have a list of those doctors and those hospitals, we run a list compared to the Canopy network. What we've been surprised to find is that there's been a high percentage of matches between the employees, doctors that are both in the Blue Shield and the Canopy network, and the hospitals are in the network. And there's also a big savings. So what we do is we go back to them with the data, and we are starting to see some employers moving because why are they going to pay a premium when they can access the same doctors and same hospitals going through Canopy versus going through your traditional carriers like Blue Shield or United Healthcare, for example. So this is something that I want to make sure everyone understands how this is working. You want to ask for the owner's family and get their doctors and hospitals. We will do a comparison against the Canopy network and share with you that if there is a high percentage of match, there's going to be a savings of premium involved, and it may make sense to move that group over. So the members, they also have a cost estimator when they go over to Canopy. Again, they are moving to an HMO, so we are being very transparent about it. But this HMO is not like your traditional HMOs that we've seen here in Northern California. This is the only HMO that has ever actually worked, in my opinion, here in California, in Northern California, because you have access to so many different facilities, providers, hospitals, that it looks and feels like a PPO. And so what you want to do is anytime you have an opportunity to quote Kaiser Direct alongside of United Healthcare, most brokers will only quote the PPO with United Healthcare. You want to quote the Signature Value Advantage HMO. You want to give the employees the opportunity to go ahead and have access to UCSF at a significant discount versus paying the PPO premiums with United Healthcare. And so now they have three options. They can go to Kaiser, they can go to UHC, Signature Value HMOs, which is Canopy, or they could go to UHC PPO plan. This really helps a lot of the employees that would love to go to a PPO option but do not have the budget to go ahead and pay for that premium. This is a great way of doing that. We do see this picking up momentum here in 2018. This is something that if you are the incumbent broker, you definitely want to talk about Canopy, because a lot of the challenging brokers looking for business are leading with this and saying, why didn't your incumbent broker talk to you about this option? You have the same doctors, same hospitals at a lower cost. Why would you not do that? So this is something we want to make sure you're aware of. If you have any questions on it, please let me know. But this is something that you want to definitely be looking at as a marketing prospecting tool in 2018. Some of the resources we have available for you, we have eCentral. Right now, we're going to be honest with you, 10% of our groups are enrolled with eCentral. That number is going up. So not every group is enrolling onto eCentral, specifically the smaller size groups, where if you have a group of 6, how many ads or deletes are they going to have in a calendar year? So does it make sense? And is the owner or the HR manager going to actually use it? So those are conversations you want to have. For our team, we have a dedicated group specialist. We have Tracy and Heather available to quote. They're here 8 hours a day, so if you need that, let us know. Enrollment support, I can help as a carrier representative do any enrollment meetings that you may need. We also have the paper copies available should you need those as well. One of the things I had mentioned is when we talk about the network and provider searches, this is what it's going to look like. So for example, if you give us the hospitals and we would run the searches, we'll tell you based on the hospitals, the clinics, the hospitals, medical groups, the pharmacies, the providers, what is the percentage of matches that are available versus the incumbent. In this example, you'll see the clinics match 50% with Aetna. The Blue Shield clinics match 17. But hospitals are the key. So it looks like here, Health Net had 71% of the hospitals matching. So this is one of the key pieces of data that we want to provide you with to go back to your employer. The other thing we want to share with you is this is an employer that the providers are listed up top, the medical groups are there, the clinics, and we'll basically put it in this order. So that way, if the owner has to go see Dr. Wellman up here at the top, they'll know that we can't go to Anthem in this scenario because Anthem is not in network with Dr. Wellman. So these are things, the data that we want to make sure you have available to you. And it looks pretty impressive when you go back with this level of data and analysis to be able to go to your group with confidence, knowing you're going to move them to carrier A to carrier B, and knowing who and who will not be affected. This is very helpful information. So if you need this, please let us know. What we're doing right now for Canopy is getting a list of the doctors and the hospitals to do that comparison. This is a little bit more detailed, which includes the providers, the medical groups, the hospitals, even down to the clinics and the pharmacies. So all this is available to you. Please take advantage of that. Once a group is approved, we're going to send you a group approval letter. The group approval letter is going to look like this. It's going to let you know where the administrative kits are going to be mailed to. It's going to tell you when you're going to get your ID cards, how many ID cards you're going to get, the new hire, termination, and change process, how that is done, and how you're going to verify benefits. And these are all the contact numbers you're going to need for the policy that was just installed. Very helpful information that you can provide to your group and to your for your office. The next one is being a good consumer. This is something that I wanted to share with you. This is quick tips before eligibility. What do you need to know about your ID cards? And as some of you that are prospecting, it's important for you to have data when we talk about adding value. Every time you respond to a prospect with an email, you need to include some piece of valuable data that they're going to find meaningful. This is something that we send out. This is a healthcare consumer quick tips for eligibility. As you're corresponding with your prospects and even your existing clients, this is a piece of data you want to have available off to the side. And hey, I was just thinking of you. You know, this is a great way for your employees to save money and to be more efficient use and a consumer of healthcare. This is how they look about getting their, and again, this is before eligibility. So usually the groups are coming in at the end of the month. We send this out to go ahead and give the employees, they need to fill their prescriptions prior to them being effective to avoid the out-of-pocket. This is what you're going to do, how to get your deductible credit. This is how you do pre-authorization and emergency care. Once the group is installed, now we need to switch over and we need to notify everybody that we have a new provider in place. You want to confirm that you've got your correct ID card. You want to obtain your preventive care and immunizations. You want to be using telemedicine, which is the other thing that a lot of people are not talking about. You want to start using that as well. And these are quick tips. And again, it's important for you to have content to be able to share, and always look for ways to increase value through any means of dialogue with your either your prospects or your clients. And this is one tool that when we send this to you, you should be using this as well. As we move on, our website is one of the very valuable tools that differentiate us as a GA. One of the things I wanted to share with you today is when you go into our website, you'll notice that this is under back pocket. One of the things that's very helpful that brokers are using are called network comparisons. It's right here. Once you click on network comparisons, I want to generate a hospital comparison. So for example, if I know I'm going to write a group in Contra Costa County, and I want to go ahead and compare in this example, and I'm going to look at all my employees are in Alameda, Contra Costa, and I'm going to be comparing the Anthem Prudent Buyer. I'm going to be looking at also HealthNet, or let's say United Healthcare, for example, the Signature Plus. And also I may be looking at a narrower network to see if that's something I can go ahead and put that into. And let's just say, for example, I'm going to be using the core. So now we hit compare networks. Anything in red that a hospital is not in the network. Anything here with an S is a Sutter facility. So you'll notice in this example, we can go ahead and move the group to these providers as long as, but if somebody needs the San Ramon Regional Medical Center, we don't want to put them into the core network because it's not there. This is a great tool to access to be able to give your employer immediate understanding of which facilities, in this case hospitals, are in the network and which ones are not. As we click back, we go back to Back Pocket, which is the resource here. The other comparison we want to do is underwriting. So you'll notice the underwriting is here. You can access it two ways. You can either go here or go under here. I want to access an underwriting comparison. So for example, if we want to access all the carriers and I have an owner-only group, I want to know it's an S Corp. Will anybody take an owner-only group, or do I have to put somebody on payroll as a W-2? Well, as soon as I hit generate, you're going to see that Aetna won't take it. If I have a C Corp, I can write it with Anthem. Shield won't take it. CalChoice won't take it. HealthNet won't take it. It's an S Corp owner-only group. I can go with United Healthcare. Here you go. So this is extremely helpful when you're in a situation where you have certain scenarios. You want to be able to go ahead, use this tool quickly, and eliminate, not even show these other carriers, because this is the only carrier that will take an S Corp owner-only group without a W-2 employee. Very helpful generator tool. So as we go back, we have the custom generators, as I just pointed out. We have competitive plans by county. So I know that if I'm going to Contra Costa County, I should be selling Anthem Blue Cross, because you'll notice that this is the most competitive by plan design by county. Now, if I'm going to be going over to Alameda, you'll notice that the carrier changes. And if I'm looking at going to Bronze within Alameda, I need to go to Aetna. And if it's Silver, I need to go to United Healthcare. This is a very helpful tool for your existing and prospecting groups. If they are not currently on one of these plan designs in this county, they could be saving money. Now again, there's a percentage, as we talked about before, maybe it's only a couple of percent, but these are the carriers that are the most competitive by rating region based on the plan designs that are listed here. Now, if you have a question as to where they're located, you just flip to the back. These are the 19 rating regions in California. All of them are represented here. So if you have a group in any of these areas, we can immediately figure out what is the most competitive plan for you. In San Francisco, again, you'll see here, it's Anthem Blue Cross. Now we're going to talk about prospecting. So cold call prospecting is very difficult, but it is not impossible, and there are an enormous number of benefits associated with cold call prospecting. And again, first of all, you have to have a mindset, because a lot of people don't make the call. So if I don't make the call, what is the worst thing that will happen to me? Well, if I don't make the call, I'm not going to have the revenue generated, because I'm not going to have a sale, and I may even lose my job. So that's the worst thing that will happen if I don't make the call. If I do make the call, I actually will increase revenue, and the worst thing that can happen is maybe they hang up on me. So once you actually make a list of what is the worst thing that can happen, which is I lose my job, having somebody hang up on you is not something you need to be fearing, because it is a numbers game. It is the most efficient way to grow your revenue, which you must do to be successful in this industry that you're in. So there are a lot of benefits of cold calling, and I wanted to share with those with you today. It is the most cost-effective way of getting in front of or contacting a prospect. You dial a phone number, you hang up, you dial another one. You're not traveling, you're not walking door to door. You can cover an enormous number of employers in a very short period of time. So you want to be using this tool. And if I had one tool to pick, if it was the internet, if it was the telephone, it was Facebook, I would give me the phone. The phone by far is the best way to communicate with people than any of those other tools I just mentioned. It is preemptive. I am interrupting you. So I say, hi, my name is Pat, and the next thing that comes out of your mouth is going to be so important, because you have 20 seconds to get somebody's attention. And the important thing is you need to solve a problem. You need to build common ground. There's a lot of things you need to do. It is preemptive. So as we go through this, actually I'll go down this list here, and then I'll share with you, I'll finish that thought. Fewer and fewer people are using cold calls. You cannot contact individuals because there's a do not call list, but you're okay to contact employers. A lot of people do not use this tool because they're not good at it. And so that's why I would encourage you to embrace the cold call prospecting. You're targeting people. So in advance, you want to get a list of folks that either are groups that are blue collar, for example, under 20 lives. You know, whatever your prospecting strike zone is, you want to have that defined ahead of time. It does empower you because once you get the confidence level and have the right mindset and attitude for it, people do extremely well that are on the phone. And now you're able to establish new relationships that would normally take a much longer time than getting on the phone. Here are some of the basics I wanted to share with you. Frequency is better than perfection. Most people spend so much time critiquing their scripts and they never get on the phone. And basically, it's a way of holding off rejection. And so when you find yourself doing that, get on the phone. And as you go through, once you hang up, you can actually critique the call and find out what went well, what didn't go well, and tweak it that way rather than taking all this time to try and perfect the script, which is basically delaying getting on the phone. Preparation is vital. You need to make sure that you understand what makes you, your product, and your company unique. What is your big claim to fame? What differentiates you from anyone else in the marketplace? You have to know what that is. You have to state that up front. And proper expectation of what is required. I'm going to need, before you get off the phone, you have to get their their email address, ideally their cell phone or their telephone number, so that way you can follow up. Now let's talk about some of the golden rules of prospecting. You never want to rely on one form of communication. We almost look like this from almost a battle standpoint. I was in the Army, and so we would never go in with one plan. You would go from the air, the sea, and the land. So what I mean by that is you want to make sure that you're using text, you're using phone calls, you drop in and use visits. We have brokers now that are using video. There's a tool now where I can send a 30-second video, attach it to my email, and send that to my customer. Millennials love YouTube. They're actually, more people would love to click on a 30-second video. They're not going to read a 2-page letter of why your company is better than somebody else. The content needs to be short, it needs to be tight, and the video is a great way to break up that. Some of the things you always want to do, you always want to be honest, transparent, straightforward. You always want to be present. Some people are calling and there's distractions in the background, kids are talking or there's dogs barking. Don't obviously do that. It's very distracting. Be 100% present when you're on that phone with that prospect or customer. Identify and solve a problem. Anytime you go to a client meeting, most people will just open up their brochures and rattle through a bunch of information and get up and leave. The issue is you have not solved the problem. All your content may solve multiple problems, but if I asked you on the phone today, what is one problem, if I can solve for you today, would enable me to be your GA immediately? Maybe it's service, maybe it's quoting. But once I ask you that question, what is one problem I can solve for you today? And I stop and I listen for the answer to that question. Once I get that response, I know how to tailor my entire presentation around that one issue, because you just mentioned what the hot button is. Most people will never ask, what is the one problem I can solve for you today? But you need to understand that before you rattle off with 30 minutes of material that they may not have any interest in, and at the end of it, you still haven't solved their problem. So we always say that telling is not selling. Showing them, just like I showed you today, the tools, the comparison tools, you have to show them. People believe things that they see, not what they hear. So showing is far more effective than just telling them what you can do. Be respectful, listen, always agree. Always agree with your customer. One of the oldest rules that we use here is feel, felt, found. Even if we may not entirely agree, I know how you feel, others have felt the same way, and this is what we have found when we actually put this in place. So you agree with them, and then you gently spin it so that way your intent is heard as well. Be memorable. What happens now, the #1 problem with sales today is you are in obscurity. Nobody knows that you exist. How do you get out of obscurity is that you have to be memorable. And that is being unique in everything that you do, and doing it in a classy way. We actually had one broker that sent a baby shoe to a prospect saying they were trying to get a foot in the door. Now, you may or may not ever think about doing that, but was that person memorable? It's really important for you to be memorable, and to always, every time you send an email, add that valuable content to it. And last is be credible. Again, you may tell me how wonderful you are, but if I see it on Yelp, or if I see it through other existing customers that you have that have actually put together testimonials, now it's much more likely that I will believe you. So that's important to have as well. So how does that call prospecting work? First of all, you have to do your introduction. Hi, my name is Pat. You never give your last name. You always give you say, you welcome your, basically, thank you for taking my call. I know your time is valuable. Introduction. And then it's the big claim. At Beere&Purves, we have the fastest turnaround time in the industry. We have the underwriters here that have been here with the longevity. We're here in Walnut Creek. We're a local GA. And we have the tools that no other GA has to make you more profitable and increase efficiency in your office. So we have big claims that we state right up front, and that's important for you to do, because now you have my attention. As a broker, you say, we now have new resources available, which is Canopy and others, that are going to be able to reduce your benefit premiums by 10 to 20%. Can I have 10 minutes of your time to show you how this will work? And you introduce the Canopy component, and it's very effective. As we go from left to right, you're going to qualify and basically fact find. If basically one of the things that happens is you spend a lot of time on somebody who's not the decision maker. Who else besides yourself would be involved in the decision to change brokers at your company? Because you could be dealing with somebody, but they're not the decision maker. You always respectfully ask, who in addition to yourself would be involved in the decision-making process on your benefits? Now you know who else to loop in the correspondence, in the phone calls, and those things. And the close. You always make sure that you're asking, in the cold call, your whole goal is to get an appointment. Most people don't understand what the purpose of the cold call is. It is to get in front of that person to get an appointment. You're not trying to sell them on the phone because you're trying to keep it nice and tight. Your goal is to set an appointment. Can I see you on Thursday at 12, or is Friday morning better for you? You always give two options when you're setting an appointment. It provides that level of flexibility. And you narrow down their ability to wander off path, because you know exactly what your schedule looks like. Methods of communication, I kind of hinted at this. The cold call, you're going to have an email, you're going to link them in. What the most successful brokers do, they will meet with a prospect, they will go to their car. If their email address is on, or their cell phone address is on the actual business card, they will text them right from their car. I know your time is valuable. I really appreciate you taking the time today to meet with us. We'll have to send you some valuable information here in just a few moments, or in a couple of hours, or when I get back to the office, whatever you need to say. But what you did was, by sending that text, people have that phone with them 24/7. You may send a phone call and it goes to their phone at the office, or you may send an email, but in a text, people get it. And this is something you want to start incorporating more going forward. The next day, I will go ahead and link them in. Now you know what they look like. You're basically, that LinkedIn request, if that is accepted, that's another positive contact that you've established. And now you're able to access more information on that prospect through LinkedIn, which is extremely helpful. The text message we talked about. The personal visit, there's no alternative for the personal visit. That is really when you're getting in front of somebody. That is the #1 reason and way you can close sales, is personal visits. But these other ways of doing it, when we talk about having a defined follow-up process, and I'd ask each and every one of you on the phone today, do you have a defined process and procedure for selling? And most people don't. And how can you be good at something if I handed you a golf club and said, go out and play golf, and you just did the best you could, but you really didn't have a defined process and procedure? you're not going to know where your errors are at and how to get better. So that's something I would encourage you to do. Handwritten letters, those are becoming obsolete. Don't make them obsolete. We talked about being memorable. Make sure that handwritten notes are part of your follow-up process as well. So the takeaways are: don't get paralyzed, get started. Frequency and persistency are the key. You should have day 1, day 3, day 5, how you're going to be doing it. Follow-up process every time, and again, be omnipresent, which is making sure that you have text and email and other forms of communication. Some of the other advantages I want to share with you quickly: we have a local presence, as I mentioned. We can help with eCentral, going through the 6055 and 6056 reporting. We have tools and resources to help you with that. We have an EDI feed, and we have one of the few GAs with field underwriting authority to go ahead and get that done with Anthem. We have the downloads now for the SBC, so that's going to make your life easier. And we have backup for support should you need for ads, deletes, and claim resolution. eCentral is one of the other key things I mentioned. We have Ryan here in our office that is our expert on it. If you need help with setup, we can be added as a guest in 24 to 48 hours, and everything will be set up. And as soon as the group is enrolled, we drop off. Any group we write with you, we want to make sure that we help share in the costs and increasing your profitability. So if there's a group over 20 or any group, we will go ahead and pay $1.40 per month times 12 to offset your eCentral account. So anytime we write a group with you, please take advantage of broker picks. This will make working with us much more profitable, and for your office as well. We're available through Twitter, LinkedIn, YouTube, SMS, and emails. And I want to thank each and every one of you for joining today. If you do have any questions on any of the content we had, please send that back, send an email to me. Also, I will send all of the materials that we just reviewed today in an email to you this evening. And we look forward to working with you as we enter this busy season of 2018. Thanks very much. Have a great day, and go Warriors. Bye-bye.